Tips to lower blood pressure. Follow the 20 tips below to help lower your overall blood pressure, including diastolic blood pressure. 1. Focus on heart-healthy foods. Foods that are an integral part of a heart-healthy diet include vegetables, such as spinach, broccoli, and carrots. Fruits, such as apples, oranges, and bananas. Fish, particularly those rich in omega-3 fatty acids. Lean cuts of beef or pork. Skinless chicken or turkey. Eggs, fat-free or low-fat dairy products, such as cheese and yogurt. Whole grains, such as brown rice and whole-grain bread. Nuts and beans. 2. Limit saturated and trans fats. Try not to eat foods that are high in saturated or trans fats. Examples include fast food, hot dogs, and frozen food. Instead, try to focus on consuming healthy monounsaturated and polyunsaturated fats that can be found in things like avocados, olive or canola oil, and nuts. 3. Reduce sodium in your diet. Sodium can increase blood pressure, so limit your intake to 1,500 mg or less per day. 4. Eat more potassium. Potassium can actually counteract the effect that sodium has on your blood pressure. Try to boost consumption of foods rich in potassium, such as bananas, spinach, and tomatoes. 5. Lay off the caffeine. Caffeine is a stimulant that can raise blood pressure. If you have hypertension, try to limit your intake, particularly before activities that can raise blood pressure, such as exercise. 6. Cut back on alcohol. Drinking excess alcohol can raise your blood pressure. Consume it in moderation. That means 2 drinks per day for men and 1 drink per day for women. 7. Ditch sugar. Foods with added sugars can add calories to your diet that you don't need. Avoid foods and drinks that contain added sugars or sweeteners, such as soft drinks, cakes, and candies. 8. Switch to dark chocolate. A 2010 analysis of 15 studies suggests that dark chocolate may slightly reduce blood pressure. If you're eating chocolate, choose dark chocolate over other types, and make sure it's at least 70% cocoa. 9. Try the DASH eating plan. The DASH eating plan can help you practice a heart-healthy diet. According to the National Institutes of Health trusted source, several studies have shown that following the DASH diet can help lower blood pressure and cholesterol. 10. Be sure to check labels. Sometimes, you can consume foods with too many calories, sodium, or fat without knowing it. You can avoid this by carefully reading food labels, noting things such as calories per serving, sodium, and fat content. 11. Lose weight. Losing a little bit of weight can help a lot in lowering your blood pressure. In fact, you can lower your blood pressure by approximately 1 mm of mercury for every 2 pounds you lose. 12. Watch your waistline. A larger waistline can put you at a greater risk of heart disease. Generally speaking, to reduce their risk, trusted source, men should aim to keep their waistline under 40 inches. Women should try for less than 35 inches. 13. Stay active. Not only can aerobic activities and exercises help you lose weight, but they can also help you lower your blood pressure. Aim for 30 minutes of aerobic exercise most days of the week. Examples of some aerobic activities include walking, running or jogging, swimming, cycling, using an elliptical machine. 14. Reduce stress. Stress is another thing that can raise your blood pressure. Try to avoid things that trigger stress. Practicing activities such as meditation or deep breathing may also help lower stress. 15. Stop smoking. The nicotine in cigarettes is a stimulant that can increase your blood pressure. It can also lead to injury of the walls of your blood vessels. Not only is quitting smoking beneficial for your overall health, but it can also help lower your blood pressure. 16. Try supplements. Although more research may be needed, some studies show that supplements such as garlic, trusted source, can help lower blood pressure. 17. Use probiotics. Probiotics are bacteria that are beneficial to your digestion. A 2016 review article, trusted source, suggests that taking probiotics may work to lower blood pressure. However, more studies are needed to gain a better understanding of how exactly probiotics affect blood pressure. 18. Give acupuncture a try. A 2007 study indicated that traditional Chinese acupuncture helped lower blood pressure. However, this effect went away after acupuncture treatment stopped. 19. Monitor blood pressure at home. Monitoring your blood pressure at home not only helps you know if your treatment is working, but it can also alert you if your hypertension is worsening. 20. Consider prescription medications. Your doctor may prescribe medication to help lower your blood pressure. Common blood pressure medications include thiazide diuretics, calcium channel blockers, angiotensin converting enzyme inhibitors, angiotensin II receptor blockers.